My name's Ranj Singh. I am an NHS and a TV doctor, and I'm here because I care about the issues that affect young people. No recent government has a clean bill of health when it comes to interfering with our NHS. It's about time we put patients before politics. Watching political parties clash over who's to blame for failing hospitals is a depressing sight.
You say the problems are much more widespread than even after the Keogh report.
Yeah, the Keogh report looked at 14 trusts and highlighted several deficiencies and recommended improvements, but every hospital around the country has scope to improve to some extent. Despite promising no more top-down reorganisation of the NHS, the current government is doing just that. The difficulty is that these trusts are full of people that are working their hardest to make it work. There's a very small proportion that could do better, I agree, but the vast majority are doing the best they can. It's not their fault. When people are transitioned from CAMS to adult services, that transition should be integrated, it should be graded, and I think that if we started listening to young people, taking them seriously and actually giving them a voice that they should have, then we wouldn't have a lot of these problems. Only 4% of young people experienced a good transition. Only 4%. I think that's a shocking figure.
Where do we begin? At the bottom or the top?
Well, it's a bit of a squishy subject, I think. Taking laxatives, you lose water, you will lose electrolytes and salts, and you will lose unabsorbable things like fibre. This is called the Bristol stool chart, developed in the 90s, and unfortunately you will lose weight because you're losing those things. You're not necessarily losing any fat. The good poo is this one over here, number 4. It's smooth, it's sausage-like, it's soft and squishy. That's what I tell kids. Number 4 is that one just there. The more constipated you get, you end up going towards number 1.
What you don't want is number 3 poo, which is like a sausage but with cracks on the surface. Very important bit of that.
With summer just around the corner, it's natural to want to get our children outside in the sun. But many parents are unknowingly risking their children's health with inaccurate information about sun protection. It's a really great thing that there are lots of health stories out there in the media because it gets people thinking about their bodies and about their health and about their behaviours. Unfortunately, the vast majority of information that's out there is either biased or slanted or not presented accurately. The O stands for oral rehydration solution, so that's if you've got the runs.
And that doesn't mean beer.
No, unfortunately not. Where does your poo come from? Why does it stop? Stay in your bottom and not make a plop. My name's Dr Ranj Singh, and I've got some useful advice for parents around cot death. I'm going to come over here and show you about babies because I've left my little friend Bob here. Babies, again, check the airway, try and get it out if it's easily accessible, making sure that they don't overheat, so keep the room at 18 degrees. Back blows, same way, lean them forward, 5 back blows like we did with Ella. There's lots of things that we shouldn't do, for instance, smoking around your baby and being careful about co-sleeping. One thing I will say is, as a young person, don't be scared to come forward for help. There are lots of people that are out there specifically rooting for you, trying to listen to you. Make sure you've got a voice, and we will listen.